3 years of the COVID-19 pandemic highlighted the need for effective readiness, resilience and response. In a global health crisis, pre-existing gender inequalities also indicate the vulnerability of women and girls. But to help us understand and guide us through the effective measures in the face of a pandemic, Higher Health CEO Professor Ramneek Ahluwalia now joins us. Professor, thank you so much for your time this evening and for joining us. Now, as mentioned, COVID-19 hit us when we least expected a tragedy of that nature. What would you highlight as one of the biggest exposures that COVID-19 really showed us during that period?
Good evening, Katleko, and thank you for inviting me. You're right, Katleko. It's a brutal reminder of what microorganisms, viruses, bacteria can do to human life. Our human survival depends on it. Climate change is so real that the mutations of the viruses that were taking years to happen are now taking months and days to happen. and that is exactly where we find as a world ourselves. So COVID-19 will not only be the only epidemic or a pandemic that we will see in our lifetime. I mean, human survival has seen so many pandemics. The influenza pandemic that happens in the early 2000s, early 1900s, 19th century, the smallpox, which has been a brutal killer of so many centuries in the human mankind. So I think pandemics are real. COVID-19 brought a new reality for a new changing world. It brought a lot of evidence in front of our non-preparation as nations. We've suddenly started realizing that if one nation starts having a pandemic, the world is so interconnected that's a matter of time that the whole world is grappling with the pandemic. So COVID-19 did not affect one nation or few nations or a continent. It spread so globally to every part of the world. And it's raising some questions. When the rich countries started storing vaccines towards them, when the vaccine innovation started coming in, and the African continent was left behind, they didn't realize that the mutations will continue happening in the African continent, and the same virus will still go and kill the vaccine immunity same back in the developed world, which means vaccine equity was needed. What it starts saying is that scientific data needs to be shared. We need to have common scientific research programs between global south and global north. We need to put center of hubs in both developing and developed nations. And so this cannot be just a scientific research program in a developed nation trying to fight and understand a disease when the disease can spread globally. So I think it's caught the world in wanting. It raised many questions. It raised questions of equity, equality. And I think that the point that we will also be discussing in this interview will be gender inequality, that raised so many issues about how young women or women in general found so vulnerable to a pandemic that was so common to every Homo sapiens sapiens or every human being in general.
Most certainly, Doctor, and we will certainly touch on the inequalities especially experienced by females across the continent. But speaking of some of those health emergencies that we already experienced as the African continent, one would expect that Africa would have been better prepared when COVID-19 hit.
And it was, to be very honest. I mean, the HIV pandemic, specifically in Southern Africa, the malarial epidemic had put so much of community infrastructure, which allows us to prepare better. Our surveillance systems, our community, civil societies, our NGO mechanisms, they were pretty strong in the community, which means if a communication to villages, to rural towns, to spreading an information through peer-to-peer networks can happen. And because we as African continent grapple so much with so many different kinds of epidemics and pandemics that happen so frequently to our continent, and South Africa is one of the known country that had to deal with, which is still currently dealing with one of the major epidemic called HIV. And reality of HIV epidemic really made us understand how community strengthening, surveillance in the community mechanisms, what's the power of civil society and NGO, the growth of activism that can change a thinking and the preparation of us dealing with an epidemic or a pandemic of such a kind. So I think it did help. But however, the inequality that remained in a developing country, developing nation like or continent like Africa, where we didn't have huge research centers or R&D or research and development programs, our vaccination manufacturing plants were not there. That exposed our continent quite aggressively when the world was able to produce vaccines at a very fast pace and started saving lives. We, on the other hand, were caught wanting due to lack of our own manufacturing, our own research, our own development agenda, which let us remain behind. And what it also taught the world was you cannot leave the developing nations or nations which do not have manufacturing centers or research centers to be left behind, because the virus will keep on trying to mutate in a non-vaccinated bodies. So vaccine equity was very critical. So I think both sides, Africa was advantageous at a certain level, and that's why we had very less fatalities compared to the Western world or the global North in general when it came to COVID-19. But on the other side, we were also caught wanting on many things that we need to now prepare. It's a brutal reminder, and it's a wake-up call for the continent to really look into deeper sense of our preparation for the next pandemic.
Most certainly. And that wake-up call, Doctor, really hit us when it came to gender inequalities. I mean, more women lost their jobs than men during COVID-19. 60% of girls not having learning material, over 44% of boys. What do you think led to this with regards to the social ills that were already pre-existing within our communities?
I think every pandemic has had the biggest toll on women and specifically young women or women in general. And there are many factors for it. I mean, the HIV pandemic, if you look at in South Africa, I'm going to raise COVID again, but in HIV pandemic, 6 out of 7 people who get new infections are women between the age of 15 and 19. Women are twice more vulnerable between 19 and 24 than men to a pandemic of HIV. When we looked at the COVID survey, and I was looking at the data between October and December of 2021, when the pandemic of COVID was very high, we saw about 1,000 murders of young women. The rates of GBV increased by about 10%. Even this year, even the early data which we have seen is quite worrying about how gender-based violence and how gender inequality puts women into a disadvantaged position when pandemics hit. And so there are many factors, historically, through generations, through centuries, patriarchy, gender inequality, gender norms in our cultural beliefs, religious factors, they have been existent, and that puts women on a back foot most of the time. So women are less socioeconomically advantageous than men. Women have to, there are child marriages of young women in certain African religions or cultural belief that believe in young women getting early marriages, not allowing for early education or education mechanisms, and in general, gender discrimination really affect a woman more than a man in general when it comes to epidemics or COVID-19 or pandemics that suddenly hit, and when jobs are lost or when there are scarcity of resources and when people are caught wanting into socioeconomic conditions. So definitely, I think in any future preparation of pandemics, as much as we are looking at developing research and development, putting vaccine manufacturing hubs or many other systems, one has to really look at the social and cultural mechanisms of socioeconomic factors of support to gender and specifically to women in general, who we know from generations that every epidemic faced the biggest letdown in any comparative mechanisms when it comes to pandemic preparations.
And speaking of those solutions that we could come up with, I mean, the Africa Risk Capacity Group, together with the Bill and Melinda Gates Foundation, are currently working on a program that looks to lessen this plight on women. How do organizations and programs such as these aim to achieve that?
I think it's very important. You know, this is one of the good examples, but there are many, and South Africa is known to it. I mean, putting education right in the front, making more access to young women completing studies and education, because education is a very important tool. Having more women now coming into vocational colleges, into technical skills, because that's the new phase of the global world where vocational and technical skills play a very central role, and having more women as skilled workers. These are factors where education, skills development, giving priority into more women education mechanisms, empowerment of women. These are very critical mechanisms where empowerment of women will be more resilient, where women will be more resilient to pandemics and preparation to pandemics. So I think the role of civil society, the role of NGOs, and the role of education towards the future outlook of even men in general, you know, a transforming mentality concept of men transforming to understand and respect the rights of a woman, giving equal gender equality. These are multiple reasons. So we have to go to the grassroots and fix the bigger issues that historically or generationally have suppressed women in general. And if that can be controlled, their resilience towards pandemics will be far more stronger. So I think initiatives of Bill Gates Foundation with CDC, these are critical interventions. They're going to put more technology hubs, more centers for focus towards women empowerment. But in general, every economy, every government needs to prioritize skills, education, and root causes, because education will challenge the cultural norms. Education will also challenge religious norms. And I think generations will change gradually, and that's how the future should look like.
Most certainly. Doctor, thank you so much for your time this evening. It certainly takes quite a bit of work that needs to be done on the ground before any other pandemic would hit the globe as COVID-19 has. So thank you so much for your input and your insights this evening. That was Higher Health CEO Dr. Ramneek Ahluwalia speaking to us there about epidemic readiness.